Okay, so I think we're ready to start. Bienvenidos. Welcome, everyone. We are so excited to have you today. We have a fabulous day set for you. Thank you for spending your day with us. My name is Dr. Olga Acosta-Price, and on behalf of the Avance Center for the Advancement of Immigrant and Refugee Health, the Metropolitan Washington Council of Governments, and the Regional Primary Care Coalition, I welcome you today to our regional conference on advancing health equity for Latino youth and families. So we'd like to take this moment, obviously first to thank you for being here and for enriching us and being a part of this really important discussion. We have fantastic speakers. We have fantastic folks who are really here to share their expertise with us today. We'd like to take a moment, though, to just thank our sponsors before we go much further into our day. The National Institute on Minority Health and Health Disparities for their sponsorship of the center as well as this conference. Certainly the Milken Institute School of Public Health at the university for their support in many ways, and Kaiser Permanente of the Mid-Atlantic States for their sponsorship. So certainly want to, again, show our appreciation for their support. A couple of things I have the pleasure, Karen, my colleague, Karen McDonald, and I have the honor of being your MCs for the day and sort of walking us through the day. We have fantastic event with enriching sessions. We have a film at lunch with a discussion, so we really encourage you, and we'll give you some prompts for that later on, that you get your lunch and come back in here so we can really enjoy this film together. And the filmmaker is with us today, as well as we have a group of young people who are here to share and provide their life narrative with us and to share some of that with us. So we're really pleased and honored to have their presence. As you might have noticed, we have beautiful pictures, sort of a photo display that we really encourage you to make sure to spend some time looking at, and to also leave notes and to offer your reactions, your thoughts in writing to them. We'll probably give you that prompt again throughout the day. It's something that would really mean a lot to them as they share their story, just to hear how it's impacted you. A couple of things. Wi-Fi. We know that Wi-Fi is very important, so we want to make sure that you know that if in your packet there is some instructions for how to get onto the Wi-Fi. If you have any difficulty whatsoever, please do go to the front desk and they will guide you through and offer you a way to get access. The bathrooms are through sort of these doors, through the double doors, and to the left. Again, also we have the pleasure of having really fantastic volunteers. So they will have, I think it will say volunteer.
Say staff.
It will say staff, so please stop any of us if you have any difficulty kind of navigating this floor and figuring out where things are. In your packet also, it's never too late to tell you that there's an evaluation form. It's very important for us that we get your feedback at the end of the day, so we will ask you and remind you that, to kind of pay attention to that and offer us your input before you leave. We have a terrific reception that is usually the talk of the town. It's really fun, and we really encourage you to stay through the day. We have, as I said, our local artists, and we want you to spend some time together kind of celebrating our event. Thank you, sir. As we mentioned, if you enjoy social media and would be willing to tweet, please note our hashtag at DMV Latino Health. Please do tweet about the conference, any sessions, things that you feel you'd like to share with your networks. And with that, I will turn it over to my colleague.
Buenos dias. Good morning, everyone.
Good morning.
Good morning, everyone. That's more like it. What a beautiful day. And I can tell you it's even made much more beautiful because I look out and see so many friends and colleagues and students. Thank you for being here today and helping us to create a wonderful discussion on a very, very pressing need. and that is to address the health equity of Latino children and families in our region. My name is Karen McDonald, and on behalf of the Avance Center at the Milken Institute School of Public Health at the George Washington University, that's a mouthful, we welcome you here today. I am joined by the Metropolitan Council of Governments and the Regional Primary Care Coalition. We know that to achieve health equity for Latino children and families in our region, it's not the efforts of one, but the achievements of many. So we're going to begin our day by hearing from our champions who advocate for the health equity of Latino children and families in our region today. And those achievements are many. So we have Sharon Zalewski, who is the Executive Director of the Regional Primary Care Coalition, Mark Edberg, who is the Principal Investigator for the Avance Center at the School of Public Health, as well as funded by the National Institute of Minority Health and Health Disparities. But let's start our day hearing from Chuck Dean, who is the Executive Director of the Metropolitan Washington Council of Governments. Thank you, Chuck.
Thank you.
Thank you.
Ok, ¿listos? Buenos días. Buenos días. Buenos días, amigos, compañeros y colegas de la región. Especialmente buenos días a los estudiantes. Estudiantes, por favor, levántese las manos. Students in the room, please raise your hand. All right, let's give applause to the children. To the students. Okay, en nombre del Consejo de Gobiernos de la Área Metropolitana de Washington, les damos las gracias por acompañarnos hoy. Para aquellos que no están familiarizados con nosotros, CAG es una asociación independiente. Reunimos líderes y expertos de nuestra área para compartir información, coordinar programas y resolver problemas regionales en el distrito y los suburbios de Maryland y Virginia. La salud y el acceso a la asistencia sanitaria son temas muy importantes para nuestra región entera y para la comunidad latina. Además, hay muchas conexiones entre la salud y otros temas regionales como el transporte, el medio ambiente y la economía. Para realizar nuestra visión para un futuro próspero con una mejor calidad de vida, estamos tratando de incluir la salud con estos otros temas en nuestros planes y programas. Estamos muy contentos hoy para reunir a algunos de los líderes de la región, funcionarios de la salud pública, profesionales sanitarios y fundaciones. Queremos trabajar juntos combatiendo disparidades de salud que afectan a la comunidad latina, especialmente la juventud y familias. La conferencia coincide con el mes de herencia hispana, ya que reconocemos y celebramos esta comunidad. Esta conferencia es una oportunidad para todos nosotros de aprender de lo que está haciendo para abordar las disparidades de salud y las formas en las que podemos trabajar juntos para romper las barreras, para romper muros y equidad de salud como el idioma. So part of my reason for delivering my first part of my remarks in Spanish is to remind myself of the barriers that are faced. Yesterday, I was with my doctor. I have health insurance. I literally got a degree in bureaucracy from Harvard. And I speak passable English. But for about 5 minutes, I told him about the problems I had accessing his system, getting through the calls, and even in English, a person said, the doctor has reviewed the test. Okay, so then I'm ready to see the doctor. Well, we need to send the test over to him. Now, I can't really parse that in English, and I think a second language speaker would find that difficult too. So that just reminds us that there are many barriers that we need to work on. Now, today, I just talk a little bit about the barrier of language. My organization, the Council of Governments, is an association of local governments that brings together leaders and experts to share information, coordinate on problems, and develop solutions to regions' problems. Public health and health care access are important regional issues, especially for Latino youth and families. And we're trying to connect that, find the connections between transportation, mobility, and access, also the environment, and also the economy, linking health with all those other areas. At COG, we're encouraging area leaders to look across challenges and across borders to solve problems throughout the region. And I think today's conference is an opportunity to do just that. I think today we can learn how different organizations and government agencies in the region are helping to break down some of those barriers, break down those walls. And hopefully we can make connections that will lead to additional partnership and progress. I want to recognize our partners who helped organize the event, the George Washington University Avance Center and the Regional Primary Care Coalition. It's partnerships like these that help us advance on these many challenges. I want to also recognize some of the area officials who will be coming here today. I know that Supervisor Penny Gross from Fairfax County will be coming. I saw Uma Alawalia, Sonia Moore from the Montgomery County Department of Health and Human Services, and Christian Barrera from the District of Columbia Deputy Mayor's Office. I think we're all intrigued to hear from Armando coming up in just a few moments. We appreciate all that you've done for the region and the Latino community in documenting some of the special opportunities and challenges. One final note, I want to encourage you to use our regional healthcare and community resources directory. I wonder if somebody could hold that up. So look, our Jenny Sheeter, our Director of Health Programming at the Council of Governments, has got that in front row. So please use that directory, or you can download that and refer people to our website, mwcog.org. Thanks again for your participation. Gracias por su participación. And allow me to introduce, please, Sharon Zalewski, the Executive Director of the Regional Primary Care Coalition. Let's give Sharon a hand.
So, good morning, everybody. I'm really pleased to be here and be working in partnership with the Avance Center for the Advancement of Immigrant Health and the Metropolitan Washington Council of Governments. I think, a couple of things that you're going to learn here today is just how important partnerships are in addressing health and quality of life issues across the region. So the Regional Primary Care Coalition works with the local philanthropic community and primary care coalitions representing more than 40 safety net primary health care providers throughout the region. And so that means 2 counties in Maryland, the District of Columbia, 4 counties, 5 incorporated cities in Northern Virginia. So one of the things I'd really like to know is how many people here today are from Virginia? Yes, thank you. You struggled across with transportation, I'm sure. Since Chuck is here, I can say that. How many people here are from the district? Very good. How many people from Maryland? Okay, so we have a nice representative group here of all the people from across the region. And although we all, when we work, do our work in healthcare and other sectors, we often think in terms of jurisdictional boundaries. But in fact, people who live in the area cross boundaries all the time in our daily lives without ever thinking about it. Work, school, play, church, to be with family and friends, to go to a restaurant, whatever. You travel across, you don't think that you're crossing a state line or a district line when you're out and about. So also compared to other parts of the country, we are a very well-resourced area. We have lower unemployment than most places and greater opportunity. We all live and work under many of the same conditions. However, there are significant disparities, persistent health disparities, and inequities in our community. And these are largely related to income, opportunity, race, ethnicity, and immigration status. And, immigration status, a lot of people have gotten access to health care with the implementation of the ACA. But immigration status remains one of the greatest barriers to access to care. That being said, access to care is only a piece of what it takes to be healthy and to have a high quality of life. So the Latino community in particular and other communities in this area have higher rates of chronic illness, persistent behavioral health conditions, higher risk of injury, and lower life expectancy. This conference was intentionally designed to look at the relationships between health and underlying determinants of health. We brought in several different sectors, education, housing, in the hope of developing cross-sector capacity to address health disparities by improving the quality of life. We want to look at the whole thing. I hope today's event will serve not only to provide information to you, but also to have you network and build partnerships during this conference that will allow you to address health disparities. So it's now my privilege to introduce Mark Edberg, the director of the Avance Center for the Advancement of Immigrant Health.
So I'm now the director of the Fiance Center. So I don't know what that means, but otra vez, bienvenidos y muchísimas gracias para su interés. Y voy a hablar unos pocos minutos sobre el Avance Center y las actividades corrientes. So I'm going to speak just a little bit about what the Avance Center is and some of the things that we've are doing now, and kind of a summation of some activities that we've been doing over the past 4 years. This is actually our 5th year now of being funded by the National Institute on Minority Health and Health Disparities. And I want to again thank the Regional Primary Care Coalition and the Washington Council of Governments, without whom we would not be able to do this, and to thank all our friends and partners and collaborators who are in the audience. Not untypically, I have way too many slides, but I'll go through them quickly, I promise. Just so you get a sense again for what the Avance Center is, it is something called a P20 Exploratory Research Center on Health Disparities. And what those centers do, it is exploratory. So we address health disparities in specific populations through community collaboration, through capacity building, and I mean that in a mutual sense. So we work to develop capacity in the community, and the community helps develop our capacity and our knowledge. Through community engagement and through exploratory research and interventions to try and address some of these disparities. And so we are, as we know, we are focused on disparities in the Latino immigrant population in this area. So just a few, I know it's a very dense slide, so I'll just kind of summarize it quickly. What we've been doing, there are a couple of primary interventions that we have in the center. One of them is called Adelante, which means forward in Spanish. And this is a multi-level, community-based, positive youth development intervention that is aimed at preventing, and this is a mouthful, the co-occurrence of substance abuse, sexual risk, and interpersonal violence. And we call that, the disparity is actually the co-occurrence. It isn't just one of those things individually. It's the co-occurrence of all of those 3 things in Latino youth. And to date, we've done a lot of activities over the past 4 years. And of course, any intervention like this, which is a test, involves some time to put it in place, to gain trust and collaboration with the community. Served about 537 unduplicated individuals. That's in the activities that are specifically oriented toward curricula and prevention and things like that. Many more through tutoring, through soccer, through fairs, through media and communications activities, of which some of them have gotten a lot of recognition in the community. And then a lot of parents and families served through a broad range of activities that we're doing in this positive youth development model, which is intended to build community capacity as a means of prevention. We've also collected data at baseline, year 3 and year 5, and we are now in the process of analyzing that to see whether or not the activities we did had any effect. We've been engaged in a number of engagement strategies, lots of social media, the development of the Victor and Erica YouTube series, social media, health literacy and other things like that. And then we've also, as part of one of the other main activities of the center, we've conducted a symposium and now three conferences, as well as worked to get students to do their practicums and their doctoral or other research in the community collaboratively. We've also developed a community advisory board, which has participated in several of the interventions. And we have a more recent project, and Dr. Uri Colon Ramos, raise your hand, is the director of that project. That is funded by the Centers for Disease Control and Prevention, but it is part of the center. And this is a program, a collaboration with the community to address poor nutrition and risks for diabetes, focusing on promoting water versus sugary beverages, because that's one of the key causes of diabetes in the Latino community. And so there are many parts to that intervention, including youth advocacy, including a media campaign, and a test of an intervention where in a school there will be filtered water and promotion compared to schools that do not have that, to see if that increases the consumption of water by students in a school. And so baseline and follow-up data will be collected for that as well. So again, these are all activities that are done in partnership, and the list of partners is too long, but Maryland Multicultural Youth Center, Rivera Group, Centro NIA, and many others in the community have been involved with these interventions. Just very quickly, I'll skip through these, but these are just an example of some of the media campaign, which had posters and social media and other things, where we, and you can see the logo. This is our Adelante logo, which was developed by youth. Notice the corner. That's the motif of turning the corner, which came from youth. This is the Water Up campaign, which is part of the REACH project. This is just one component of that. And again, this is trying to sort of brand drinking water as something that's part of life and energy and so on and so forth. So just to sum up briefly, what we are doing now, this is our fifth year. We are continuing to strengthen our partnerships and collaborations in the community and elsewhere. We are definitely in the mode of building sustainability, and that includes looking for funding and collaborations for sustained funding, because really, and this is a message that cannot be understated, is that in order to address disparities, I don't care where, you cannot do it in 5 minutes. You have to build trust, you have to engage with the community, you have to learn from the community, and it's a process. And if anyone thinks in Congress or wherever else that you can drop a few dollars in a bucket and solve this, you can't. And so we want to make sure that message is clear, and hopefully we will be able to do that. And then the last thing I want to say is that we are sort of in the process, and we have a small grant to do this, is to try to look at we have a small ethnographic research project to look at health disparities not as a border-up issue. Too many times we think of this as, these are just disparities of immigrants who are here and they crossed the border and now they're here. But really, this, disparities for immigrants is a cyclical process that begins in the home country with situations that are there, moves to a torturous and sometimes, very terrible migration process, and then difficult readjustment when here. So all of those domains have to do with disparities, and really, if you want to address disparities, you need to think of those three domains. So with that, I will pass the mantle back to Karen and or to Olga, and just to say that NIMHD, the representative, the director who was going to be here, got pulled away to something else. So Dr. Perez Stable will not be showing today.
Thank you.